Hi, I'm Becca. I'm trying to learn medicine today, Addison's disease, and after we've done that, we're going to do median plane training. And if you participate in the median plane training, then it's at your own risk. And we're talking about a disease, internal anatomy, and this is no medical advice, so we're just reading about it. Addison's disease, this is part 2. Addison's disease, a very rare disorder in which the body becomes incapable of reacting to physical stresses because the adrenal glands, we found it out, the other one above the kidneys, and these glands, which control the metabolism of salts and sexual organs, cease to work. Symptoms also come on gradually and may be difficult to recognize. But if early symptoms are neglected, the first apparent symptom may be sudden collapse. Okay, symptoms: increasing weakness and tiredness leading to complete exhaustion. Did we do it? Loss of appetite, nausea and abdominal pain, fainting on standing, caused by low blood pressure, darkening of skin, accentuated by sunlight. We didn't do it. Dark patches inside the mouth, collapse after minor physical stresses such as slight infections or injuries. Okay, we're going to treat it now the way as if we hadn't done it previously. Okay, this is a very rare disorder. We're starting again. So, a very rare disorder in which the body becomes incapable of reacting to physical stresses because the adrenal glands, the glands which control the metabolism of salts and sex organs, cease to work. The whole system of the glands. I noticed that when I saw the picture, I also saw to one of the course where the glands are, but they are above the kidneys, the adrenal glands. Are they just as few organs all over the body and in some places? It seems like that, with a pituitary gland in the brain, and we had something else. But I never have seen someone having a model like with the organs, with the stomach and the intestine, the heart, the lungs, and so on. I never had seen someone the model with here are the glands. The whole concept of the glands is now, and these glands, and also are these glands when doing different things, and also the names. They are called this gland, this gland. The organs are not called lung organ, heart organ, at least not in normal speaking. But if, let's say, the adrenal glands cease to work, and the person then, if undiagnosed and untreated, the condition can cause eventual circulatory collapse and death, if they are as important as an organ. Is there a lack in something? Okay, the adrenal glands, they stop to work. It is a very rare disorder. And the adrenal glands are stopping to work because they are not other glands who can then jump in, or is it like the organs? They cannot just start the heart, start to breathe if the lungs collapse. Symptoms often come on gradually and may be difficult to recognize. But if early symptoms are neglected, the first apparent symptom may be sudden collapse. Okay, Addison's disease. Now the symptoms: increasing weakness and tiredness leading to complete exhaustion. Okay, the person gets more and more weak and exhausted and then completely exhausted. Loss of appetite, nausea and abdominal pain. I came across nausea. So we're talking a bit more over the course of the video also more about more medical things. Vomiting is a pure act of puking it out. And nausea is the feeling, I think. And there was another thing. There wasn't bloating, but something similar. That is the feeling of being full. Nausea is feeling something like that. And vomiting is when puking out. I think that's it. Loss of appetite, nausea, and abdominal pains can happen after Addison's disease. Faintness on standing, caused by low blood pressure. So fainting when standing up, because of low blood pressure. Darkening of the skin, accentuated by sunlight. The people have darkened skin, accentuated by sunlight. Dark patches inside the mouth. Collapse after minor physical stresses such as slight infections or injuries. Now it's interesting how long it takes for the thing, weeks, months, or years, for Addison's disease to come. Duration: the condition is permanent and drug treatment must continue indefinitely. This book's from the 80s. Maybe some things have changed. Okay, the condition is permanently and the drug treatment has to be done and continually. Causes destruction of the outer layers of the adrenal glands by autoimmune processes. That is, the body's own defenses somehow react against the gland's tissue. Maybe we had it. Okay, the autoimmune system attacks the own adrenal glands and also related by tuberculosis infection. Now we're going to do a second part to Addison's disease because there's something else. We have the adrenal glands, where we are, that was already last part, and the nausea, that is the feeling of being about to puke up or something, or close to it, and the bleating, bloating was it, I think. Bloating. But it was a feeling of fullness in the stomach also. Now the other thing which we didn't know where the breastbone is. Now the breastbone is the sternum, and the sternum is here. Now, and I want to do it in the video, and I want to say that. So I have a second camera, so I'm going to start off. And I want to say that what is the title? The breastbone is the sternum or something like that will be the title. It's just another. The breastbone is here in the middle, and I already did once a video about the sternum. It have 2 clavicles, and they having then here the supersternal notch, and then comes the sternum down between the ribs, and it has the manubrium at the top and the body in the middle, and then the xiphoid process down. And what I want to say just that it is the same. The breastbone is the sternum, it's just another name. The sternum is here in the middle of the chest. Here are coming the 2 clavicles, then here the supersternal notch, and then that is the sternum or the breastbone with the manubrium part, the body part, and the xiphoid process, sternum or breastbone. Want to stop the camera? But there's another thing about which I came across, and that is, we were wondering about achalasia of the cardia, and it was that I actually not read so much about it, but it is in which the muscles of the esophagus gullet fail to work properly. We call it gullet, fail to work properly. And the sphincter muscle ring at the lower end of the esophagus relaxes and lets the food pass through. And in achalasia, the esophageal muscles and the sphincter do not respond to swallow, and so food and saliva are retained in the esophagus, which becomes swollen. Now, cardia. I was wondering about it. And because it sounds like heart, because cardiology and all that thing. But the cardia is the region, and I want to do it now in the video, is the region in the stomach where these esophagus ends in. And the sphincter there is then also called cardiac sphincter. We have it in the last video found out that we have 2 sphincters, one on top and one on the bottom. And the one on the bottom is also called cardiac or cardiac sphincter. In the region of the stomach where the esophagus and esophagus is the same, just American and British spelling, where it comes in, what is called the cardiac region. I also came across this, I looked at it a little bit up, when I came across it, I think that there's maybe also one source said that also the region of the heart can be also called cardiac region, but it was just one source. The other one said, oh, the rest. The cardiac region is in the stomach, the region where the esophagus comes in. The esophagus comes from the pharynx down, then through the cardiac sphincter into the stomach, and the region where the esophagus through the cardiac sphincter comes into the stomach is called the cardiac region. Now stop the camera, but I have something else. Now, and achalasia, A's as always Greek means not, or not. A something. Achalasia. And chalasia, that means relaxation in Greek. Chalasia means relaxation, so it's achalasia of the cardiac. And it's just non-relaxation of the cardiac sphincter region, whatever. And because it does not relax, the food cannot pass into the cardiac, the upper part of the stomach, and gets stuck. And I want to have at least one video about the Greek word. No, what is it? Maybe I'm playing really. About the Greek word chalasia. Chalasia is Greek for relaxation. I'll stop the camera, and I think I'm going to start it again. But I don't know yet. Chalasia of the cardia. No, I don't know what the word means. Yes, I know what it means, but I don't really know what cardia means. It is for the cardiac region. So a word, basically, it means what it says. If we just know these one or two words in Greek, we don't have to speak completely Greek or Latin, but if we just know these one or two vocabularies in Greek or Latin, kalasia means relaxation, and it's akalaxia, non-relaxation of a cavity and cavity species. Then all these names make sense. But I think that was well. So I stop the camera, and what we're going to do now for this. So that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will do now the medium plane training. If you stay and participate in the medium plane training, that's the how it's going. We're bringing my leg up, and we're pointing the foot down. I did another thing. Okay. Now the leg to the side. Torso pointing forward and stretching the inner side of the leg. And over to the other side. And over side to side. And now to the next exercise. One leg up. Right angle with the leg, flex foot, even hips taller to the back, and press forward top against the knee. Little bend in the elbow. And the other leg up and press foot up again. And next exercise, leg up and now press from the inside, against the knee, riding over the leg, flex foot, and hips taller to the back, little bend in the elbow. And the other leg up. Little bit in. And next exercise, one leg up and the knee presses up to the side. And the other leg up. Knee presses up to the side. And now, leg up, the heavy swing go. Press on the outside. And up. And cross again. Up again. And the last time. And the other leg up. Pressing on the outside. And the last time. And now walk on the place. And we'll try to bend the legs for the park again. Now, breathe in, cross the legs. And breathe out. It was the medium plane training. I thank you very much and until the next time.